Hi. So happy March. Let's see, today's already March 4th. That's crazy. Monday, March 4th, although you guys might not be seeing this video on Monday. I'll probably post it tomorrow. So this week I wanted to talk to you about pelvic floor therapy for expecting moms or if you've just had a baby. So before or after birth. And some people, it's been in the news more lately, I would say, starting last year, maybe even 2017, that other countries like France are providing their moms with pelvic floor therapy right after they give birth. So they'll have, usually they'll be prescribed 6 weeks after they have the baby, 10 sessions of pelvic floor therapy. And they are having less issues with stress urinary incontinence as well as prolapse. So here in the United States, many women, I didn't know before I started to specialize and learned everything, not everything, I'm learning every day, but a lot about the pelvic floor and pelvic floor therapy. Obviously, that's our specialty area. Before all of this, before we had our clinic, I had no idea that pelvic floor therapy even existed. And I had already had 2 kids before we opened the clinic. And then I had a third. Great timing that first year, right, Linda? That first year that we were open. So I've had 3 kids, and 2 of them I had and didn't even know that pelvic floor therapy was a thing. So most of us in the United States, most females I would say, don't know that it exists. And a lot of our primary care physicians and OBGYNs, they don't know either. Most often what's taught in medical school is medication or surgery. For these types of issues, for pelvic pain after you have a baby or during the pregnancy as well, and especially incontinence after you have that baby. So what are we to do? What are we women to do who live here in the United States? The first thing is we've made it Optimal Living. This is the year that we are really concentrating on educating the public about pelvic floor therapy and the importance of it, especially while you're pregnant and after you've had a baby. So we're doing a lot of presentations and community outreach, just letting people know that it exists. And incontinence and pelvic pain during sex isn't something that you have to live with. So as an individual, what you can do is talk to your friends about it. Chances are, if you're having symptoms, your friends are having the same thing. It's so very common. And let them know that there's something that can be done. They don't have to stop running or stop playing with their kids or jumping on the trampoline. And the truth of the matter is it's going to get worse. If they're having those symptoms now and they don't do anything about it, as they get older, have more kids, it's going to get worse. The next thing you can do is advocate for yourself and your health care. So let your primary care physician or your OBGYN, let them know that you want pelvic floor therapy and you'd like a referral or to find out if they recommend someone in particular for you to go see. The nice thing about Arizona is we're a free access state, so you don't have to have a referral from a doctor to go to occupational therapy or physical therapy for pelvic floor therapy. Some insurances do require it, so you'd have to check with your insurance, or the clinic that you're wanting to go to could probably check for you. But more often than not, you won't have to have a referral for that therapy. The third thing that you can do is be proactive. So like I said before, if you're having any of those symptoms, even if it's just a little dribble of urine when you sneeze or you cough or laugh, and it's only happened once in the last 3 years, it's going to get worse. I don't like being the bearer of bad news, but I also don't want you to, be 10 years older and your uterus is prolapsing, or your bladder wall is infringing on your vaginal wall, and it feels like your insides are coming out. I don't want that for you. So be proactive and do the therapy while you're pregnant. There are things that you can do while you're pregnant, not only to strengthen your core and your pelvic floor, but also to lengthen and stretch those muscles and tissues that you want to be pliable in preparation for birth. So it's kind of a win-win there. You can be strengthening as well as lengthening those muscles. And then definitely after you have a baby, whether you think you need it or not, just think about France and how every new mom is prescribed pelvic floor therapy after they have a baby. So if you have any questions, certainly let us know. This will be posted on Facebook, so feel free to comment or private message us. The link to the blog is also on Facebook and our other social media pages. And if you're seeing this on YouTube, feel free to give us a call, 623-777-3113, or you can make a comment in the comments below. I hope you guys have a wonderful week, and I will see you soon. Bye.